Greetings, and I hope you're doing well today. I am super excited that you are here, and I appreciate you for tuning in. Today we are going to talk about, can movement be your new medicine? My name is Dr. Jeanette DeWitt. I am a doctor of physical therapy and a chronic pain specialist. And I am here to tell you that movement absolutely can be your new medicine. In fact, I actually have programs, Movement is Medicine. And the reason is that because the research actually confirms that movement, physical activity, exercise, they are all keys to living a healthy lifestyle. And they're helpful and keys to reducing chronic disease. Now, how can movement do this? Well, first of all, the studies show that living a sedentary life is as bad as being a smoker. Because if you are sitting all day, if you are stuck on a computer, doing technology, not moving around, you can get swelling, you can get high blood pressure, you can have poor circulation. You tend to, if you are sedentary, you tend not to be at your ideal body weight. These are all risk factors for other chronic diseases. When somebody is not moving around, when they are sedentary and when they are overweight or even clinically obese, they tend to have high blood pressure, diabetes, a higher risk of cancer, osteoarthritis, lots of different diseases that are absolutely preventable. But movement can help with that. In fact, there are studies out there that show that moving around and physical activity can reduce the signs and symptoms associated with depression. If somebody has back pain, movement or physical therapy or specific exercises that are geared to help their back can be just as effective as 1 year later, and sometimes even more effective than if the person had back surgery. This is all documented in the research. So movement can be medicine. Now, I'm not suggesting that people go off their medication and just start going around and looking at social media and finding exercises to start moving around. That is not what I'm suggesting at all. In fact, if you have not been moving around, you should actually work with a specialist to see where you are right now in terms of your physical capability, and that person, that specialist, someone like myself who's a doctor of physical therapy and also a certified personal trainer, I can help you move in a safe way so that you don't get hurt. But movement is a great way to combat the aging process. It's a great way if you are stiff and sore and achy, if you find pain relieving positions and pain relieving movements, the movement can help decrease your pain, help restore joint range of motion, help increase muscular flexibility, and improve overall mobility so that you can get down on the floor and play with your kids. You can get down on the floor and play with your grandkids. You can be more active, which increases your ability to move around even more versus somebody who continues to stay sedentary. But movement can also, if you're feeling weak and have lost balance and lost coordination, movement can help restore your balance. It can help you walk in a normal gait pattern. It can help you be more coordinated as your brain learns more skills to tell the muscles what to do. In addition, movement can help just with overall sense of well-being, because when you move, even just a 20-minute walk, you increase the endorphins in your brain. And when you increase endorphins, it's your body's natural painkillers. This is what happens when you are sore and you move around a little bit, or if you've been sitting and you're losing focus and concentration and you go and take a 20-minute walk, especially if you do it outside, and you get stimulated from your senses of moving around and you get stimulated visually by nature, you can actually increase your focus and your concentration. It also allows you to decrease any fatigue or mental burnout or depression type symptoms. It's not a cure. Movement is not a cure for everything, but it absolutely helps with reducing signs and symptoms of depression, stiffness, achiness, and soreness, as long as you are moving in a pain-free way. And what I mean by that is we do not want to move in painful positions. Now, what's the difference between being in pain? What's the difference between feeling a little sore because you did something new? That's a big difference, actually. If you take a scale of 0 to 100, 0 is no symptoms, no problem at all. 10 is, or 100 is you are going to the emergency room or the urgent care. You should really be, if you are exercising or trying something new, you should be down in that 10 to 20 range, that very mild or mild range for exercise. If you are more than that, then you overdid it. You exercise too vigorously or too intense for your current level of fitness. And that is why I recommend a specialist to help you so that when you go into physical activity, when you start moving around, you're not causing problems that aren't there, or you're not creating problems that you didn't know about but become magnified when you start moving around. I hope that this makes sense. I hope that you find value in this, but I really want to drive home the point that movement is medicine. Movement is absolutely a way to combat the signs of aging, combat fatigue. People don't think that. They think, oh, I'm tired, I should rest. No, sometimes you're tired because you've been just doing nothing. And movement can help reduce pain. Movement can restore mobility, restore strength, restore balance and coordination. And it can also just give you an overall sense of well-being. So movement can be medicine. I don't want people to stop their medication if they're taking it. I want you to work with your doctor and work with a specialist like myself to start moving in a healthy way. But movement can absolutely be medicine. And if you want to know more about that, just go ahead and comment in the feed or comment and private message me. I am happy to help kind of direct you into what your next best steps are. A little trouble with the speaking today, but the key is, I cannot stress this enough, movement is medicine, and you don't have to just pop pills to feel better. Movement, when it's done correctly and on a program that is right for you, can be the key to longevity, overall well-being, and overall good health. Thanks a lot, and have a great day.